Welcome to my life work, organ language. How do organs communicate with each other? Here is a short introduction for organ language. What means? You get an overview of the cooperation of the organs. You understand the social dynamics of the organs. You learn to integrate important criteria such as reflex zones, meridians, body characteristics in your anamnesis. You learn how to follow the cause of a disease back to its origin, and you will recognize the underlying organ work in your daily life through the symptoms. Basically, it is to be understood that the awareness of symptoms is generally based on the organ work. We are here to present different natural medicine approaches for maintaining and restoring health, but also to reveal different views of traditional nature medicine. Today's scientific, conventional medicine has reached a peak, a summit, where people are motivated to look for a holistic approach with consideration of natural remedies, more co-responsibility, but also understanding of disease and definitely finding of causes more than ever. Organ language does not replace the doctor. It also does not replace a medical approach. But organ language should also not be considered isolated. It complements every other form of therapy perfectly for the highest good of the patient. Millennia-old medicine, which is based on an oral and experiential tradition that was transmitted through myths, stories, anecdotes, and observation of the use. The essence of these ancient energetic systems was once not fixed, but with each healing encounter and with the passage of time, they continued to evolve and confirm the knowledge. Therefore, the knowledge, respectively, to sufficiently trace the origin of symptoms can minimize or even prevent the severity of a disease and additionally gives the patient the possibility to participate in a resource-oriented and mental way. Organ language follows regularities and can be applied in a comprehensible way via social dynamics of the organs, embryology, reflex zones, physical signs or behavior, and much more. Disease takes time to develop. Cancer, for example, needs 6 to 13 years. Heart disease needs 30 to 35 years. The large intestine can store intestinal contents in its wall to up to 13 years. So organ language works early to set the right course for correction. All reactions in the body have a mental origin. Then, the spirit directs the matter. The appetite for sweets has at first a mental reason, which however very soon becomes a physical reason. Sweets act in a case of insult, disappointment, like balm for the soul. Thoughts affect the body cells through neurotransmitters and cause corresponding biochemical reactions, which leads to various cravings or other actions. Organs inform us. They talk through symptoms, and emotions express themselves through organ functions. Man is the product of his thoughts. Often, in my opinion, the disease is treated at the wrong place. Vision disorders are treated with eyeglass corrections or hormones instead of supporting the kidneys and urinary bladder to eliminate uric acids in the lens of the eye or in the eye muscles as a sign of hyperacidity and questioning the cause of acidity. Hypertension is also treated with antihypertensive drugs instead of treating the partner organ small intestine, where the drugs are metabolized and actually have their effect. Lung problems often have their cause in an increased ammoniac production, and this again in too high adrenaline levels. The anger of the liver is the grief of the lungs. The severity of a disease determines whether or which measures must be taken. The earlier a person perceives his symptoms and then analyzes them in connection with organ functions, the sooner he can prevent the expansion or intensification of the disease, and thereby even avoid an intervention of the conventional medicine with many side effects. Organ language is without further doubt a challenging work, which however can be quickly learned and easily understood and memorized. Organ language is a self-organized dialogue. The moment we listen and understand how the organs speak to each other, we perceive the cause. Disease can be detected preventively and healed effectively. With the following examples, I will try to show the language of the organs. So, this is not just another method, repeating the same organ function information in an updated or more marketable format, nor is it an academic textbook written for a small number of medical academics, historians, and professionals. This method is an exploration of ancient medical healing as an art, as a practice, and as a science. It is aimed to everyone with an interest in natural medicine and healing, from the novice to the professional therapist. It is based on my attempts during my development as a naturopath to make sense of my practice and comes from my desire to identify the strategies that will best help those who come for help from natural medicine. So please enjoy the next videos and thank you for watching.